Next up, it's a real treat to welcome guests from Swansea University who have delivered the first piece of research that we've commissioned as the 1001 Critical Days Foundation. This is a world first study into how many dads die by suicide in the 1001 Critical Days. And it feels very moving to be talking about this today, which is World Suicide Prevention Day. So without further ado, let me get some slides for you and invite you to share the latest findings from your research.
So first, I'd like to say, it's a real privilege to be here at the launch of this initiative. I'm Professor Anne John. I'm a clinical professor of public health and psychiatry at Swansea. My expertise is in suicide prevention. So working with Kate, who will introduce herself next, has been a real privilege in bringing those two topics together. But my background was primary care and public health, so I really get those 1001 critical days. We've always focused, my research very much focuses on those early years and adolescence. Next slide, please. I am an epidemiologist. No one knew what an epidemiologist was before COVID, but I talk about data and I talk about rates and relationships. But in this area, we are talking about real lives lost. And it's important to remember that when we're talking about numbers. Suicide is potentially preventable, so there are real opportunities for intervention. And the impact, at the time for families and the wider community is huge, but also going into the future of children's trajectory. And that's the emotional impact, but also the economic impacts on families. And these can pass through generations. There is no routine reporting on paternal suicide in that 1001 critical days. We do have a sort of national audit for women and maternal suicide, but we don't have it for paternal suicide. And men as fathers are not really linked to their baby's records. So it's really hard to find them. So without some real change, it's hard to make that link. But also, there's no systematic recording that someone's become a father. So I think there's a real weakness there. So in Wales, we were able to do that work because of a thing called the SAIL data bank and also Syd Cymru, which looks at all suicide deaths in Wales since 2001 as part of the National Centre, which I lead. So we were pseudonymously, so we really protect people's identity, able to link birth records, death records, and households. And using various statistical rules, that's how we identified fathers. So we identified almost 300,000 fathers out of almost 500,000 babies born between 2001 and 2002 and 2021. We followed them up for that 1001 critical days. So we looked at data up to 2023 and we identified 107 fathers who had died by suicide. That's just over 5 a year. That's huge impacts on families. It's a big economic cost because these are, and the reason I talk about economic costs, that's that 7.2 million, is sometimes that's how we lead the change. Is showing that there aren't just those devastating personal costs, there are societal costs. However, the rates that we looked at involve those sorts of small numbers. So there's lots of uncertainty around those rates. And I think it's really important when we're interpreting them and talking about them to understand that. In the same time frame, 16 mothers died. And when I say time frame, I mean 2002 to 2000. 21. Now that difference reflects suicide rates that we see in the community. We know that rates are higher in men. So I guess that highlights why we're not doing that sort of parent focus on suicide. And suicide is, you know, there's never a single reason, but it really shows you those touch points of where prevention for mental health, substance use, economic conditions are really important. Next slide, please. So what we found, and what those arrows are just showing how there's a lot of there's some uncertainty around these results. But what we found was, you know, in many ways, the suicide rate for fathers in that period is lower than for males in the same period who didn't become fathers or outside that critical period. Now that's expected. And the reason it's expected is because being in a relationship, fathering children, that denotes something that's protective. A good example of that is when we did work on university students, we found that the suicide rates in university students were much lower than for those who don't make it to university. That makes sense, doesn't it? Because if you've got all those problems, you're much less likely to make it to university. But that doesn't mean that universities aren't an important setting for suicide prevention. So what we see is, although fatherhood is protective, and there was a signal, so we see that slightly higher rate, 12 to 15, first-time fathers, the rate was slightly higher. So there's a signal that we should be focusing on first-time fathers. So that transition, and we see that across suicide prevention work, transition into new social, identity, economic times is when people can be vulnerable to suicide thoughts and behaviours. So I think what this study showed us is there's a critical window. And I'm often involved with campaigns where we're encouraging men to seek help. Often we don't respond to men in distress in the way we respond to women in distress. This is a time when men are in contact with services. So it's I can't tell you the opportunity that lies there for resources, for specialist parent inclusive pathways. The other thing we found that isn't on this slide is that those from the more deprived areas, those living in the more deprived areas, fathers, were twice as likely to die by suicide than those in the least deprived areas. Now, we see that inequality across the board in almost everything I do, but it shows you areas that we should target. I'm going to hand over to Kate now.
Thank you, Anne. So this is, to our knowledge, the first national rate of paternal suicide in the first 1,001 critical days. And one of the reasons it's the first rate to be created is the sheer challenge in creating this rate and covering it when you don't have fathering linked to men's health records. And because of the quality of the SAIL data that Anne and the analytical team were able to investigate, we were able to come to uncover this rate. But that doesn't need to be the level of challenge that we have in monitoring and screening of fathers' mental health and suicides. So this is a global first, but it does not need to be the global last. And there are policy changes that will help both research and evidence-based practice. So I should have introduced myself there at the beginning, but I'm Kate Ellis-Davies and I chair the interdisciplinary perinatal mental health group. And a lot of the policies and evidence-based practice and research that we've been pushing for really are highlighted the need for those with these rate information. So we need to have a link with fathering and men's health records so that we can have national monitoring, national screening programs, and national recording of changes in paternal mental health over time and any patterns of concern that we can investigate. We've looked at screening of paternal mental health, and this at the moment is patchwork in how it's delivered. And where we've seen great promise is where we have family systems approaches, where we think about the parents and the child within that family system. Understanding that awareness is not sufficient, increasing public awareness is not an entirety goal if we don't increase training and awareness for healthcare professionals as well. And that's another big area that we need to be investigating. And next slide for that, in terms of the thinking about the research, which Anne and I are really excited to try and investigate more of what's going on here so that we can aid any guidance and support for preventing any and all of these deaths in fathers. So we need to investigate the health events and health service usage that led up to paternal self-harm and suicide in these fathers. We need to look at the family system and the impact of paternal suicide on children and to the family as a whole, and the involvement in health and social services and economic impacts, as well as educational, long-term and short-term developmental outcomes for these children in these families as well. Where we have existing pockets of screening and intervention, I think this work on rates will really support the expansion of that work, and the understanding that inclusion of fathers in perinatal mental health services has the potential, as Anne said, to target paternal mental health at this really key life transitional stage. Where we have groups where they're underrepresented in perinatal mental health research in general, that is a particular concern for us as well. So understanding the need to investigate groups that we need to have a focus on, including neurodivergent parents, parents by adoption or surrogacy, ethnic minority group parents, and gender and sexual minority group parents are all under that group that need further investigation. And our hope for this work is that those in the field can take this forward as well as ourselves. And we really want to see an expansion of consideration of fathers when we're talking about parental mental health, perinatal needs, and the outcomes for these families. And with that, we're going to hand back to you, Matt.
Thank you so much, Anne and Kate, for talking us through that really important and powerful research. I think what's really shone through is the need for us to harness that data in order to understand the needs of dads and support them better. And as Anne said, it's really important and sobering to remember that behind each of these numbers is a family that's grieving the loss of a dad and a baby that will never know who their dad was and what they were like. So really important for us to hold that in mind. We don't have the same data for England and Scotland and Northern Ireland, but if we were to extrapolate the data from Wales, it indicates that about 2 dads die every single week by suicide in the 1,001 critical days. And as Anne said, the economic arguments can often help us to persuade people that this is worth preventing rather than reacting to. So the total cost across the whole of the UK, if we extrapolate based on this Welsh data, would be about £122 million per year. So we absolutely believe that we should be preventing rather than reacting to these very distressed dads oftentimes. And it's so heartening to read the comments from professionals and practitioners who are wanting to make this change in their practice. So a hearty thank you to everyone there. I'm going to just take a moment to stop sharing my screen and come back to you, Baroness Lang, and we'll just see if we could hear from you